Cutaneous T-cell lymphoma subtypes Mycosis fungoides or MF and Sézary syndrome are multi-compartmental diseases. That's why the National Comprehensive Cancer Network guidelines recommend a multimodal diagnostic approach for optimal patient management. As we'll discuss, this includes using flow cytometry for evaluating blood involvement when appropriate. To learn more about why blood involvement matters in MF and Sézary syndrome, watch the video in the series presented by Dr. Hasseltine, dermatologist and director of the University Medical Center Cutaneous T-cell Lymphoma Clinic. Flow cytometry measures blood involvement in Mycosis fungoides and Sézary syndrome. It provides qualitative and quantitative measures of abnormal T cells or malignant Sézary cells in the blood. The advantages of flow cytometry are it is robust, quantifiable, objective, consistent, technologically precise, and becoming more widely used versus manual counts. For all these reasons, flow cytometry is recommended in the US and international guidelines, NCCN, ISCL, USCLC, and EORTC for evaluating blood involvement in patients with CTCL. So how does flow cytometry work? First, cells are tagged with fluorescent markers of interest and suspended in solution. These fluorescent cells are then injected into the flow cytometer and are evaluated as they flow past multiple lasers. Each cell is analyzed for visible light scatter and multiple fluorescence parameters. This light scatter information is collected and processed by a computer. And then the computer-generated output provides the basis for diagnosis. The report contains data on abnormal T-cell populations. No single T-cell marker can accurately identify Sézary cells by itself. To diagnose MF or Sézary syndrome, guidelines developed by an international group of flow cytometry specialists recommend a minimum of 6 panel markers. The panel markers that are used may vary between flow cytometry labs. At a minimum, they should include these 6, but labs may use additional markers as well. These markers help identify and quantify T cells and detect the malignant Sézary cells. The most common T cell abnormalities seen in MF and Sézary are loss of CD7 and or CD26. In fact, loss of CD7 has been identified in 50 to 80% of cases with blood involvement, and loss of CD26 has been identified in 70 to 100% of cases with blood involvement. When requesting flow cytometry, a complete blood count or CBC should also be ordered to help calculate absolute numbers of abnormal or malignant cells. Although flow cytometry reports can vary between labs, the report you should receive should provide a clinical interpretation of the results. This statement will report the presence or absence of abnormal T cells and whether the results are consistent with the diagnosis of cutaneous T-cell lymphoma. The report typically includes quantitative T-cell panel results, including absolute counts of T cells and percent of total lymphocytes, as well as CD4 to CD8 T cell ratios. Blood classification may be also specified. So when might you consider ordering flow cytometry? European guidelines like ESMO and EORTC recommend flow cytometry for measuring blood involvement at all stages of Mycosis fungoides and Sézary syndrome. The NCCN guidelines state that flow cytometry may be useful at diagnosis. Additionally, NCCN recommends that flow cytometry be included in the workup for any patients with T2 to T4 skin classification and any suspected extracutaneous disease. According to recently published consensus guidance, flow cytometry is recommended at diagnosis, when certain clinical flags appear and during follow-up. Here are the consensus recommendations. At diagnosis, an initial blood evaluation for all suspected Mycosis fungoides or Sézary syndrome can help with accurate diagnosis, staging, and informing prognosis. Establishing a baseline, which is important for monitoring changes in blood involvement over time, and ultimately guiding treatment approach. Flow cytometry is also recommended when certain clinical flags appear, such as in disease progression, patients with advanced disease, intractable pruritus, generalized patches and/or plaques, erythroderma, and lymphadenopathy. Flow cytometry may also be considered in the case of abnormal lab results, such as lymphocytosis and white blood cell count, or high serum LDH, as well as in lack of response to treatment. Other flags may include lymphocytosis with associated hypercalcemia or absolute eosinophilia. How often might you consider flow cytometry during follow-up with your patient? Every 3 months is recommended where practical, or in the case of abnormal flow cytometry at baseline. Flow cytometry should also be considered if there is disease or stage progression, or upon the development of any clinical flags. And if the flow cytometry results are abnormal, T-cell clonality studies should be done as follow-up to confirm clonality in diagnosis and monitoring. NCCN guidelines recommend correlating T-cell receptor studies with molecular findings from the skin to determine if clones in the blood are the same as the ones you find in the skin. Lastly, when requesting flow cytometry, keep these things in mind to optimize the utility of the test. Specify assay objectives when ordering flow cytometry, such as rule out Mycosis fungoides or Sézary syndrome. This is important for the pathologist to choose the appropriate flow cytometry panel. And remember, guidelines recommend a minimum of 6 T-cell markers. Include clinical details. A detailed description of clinical history and observations, along with any existing diagnosis, will be helpful for the pathologist to interpret the data. Use the same flow cytometry lab routinely. This may help ensure consistency in the flow cytometry methodology and the report summary. And consider consultation with a colleague who specializes in CTCL. A multidisciplinary team and consultation at a center with CTCL expertise is recommended in the NCCN guidelines for optimal patient management. Thank you for watching. I hope you find this video helpful. For more information about blood involvement in Mycosis fungoides and Sézary syndrome, including example clinical cases, explore probe in ctcl.com.